Imagine that someone next to you starts talking strangely, stumbles for no reason, or suddenly can't lift one of their arms. What would you do? Many people think it's just a passing feeling of discomfort or common dizziness. But what could actually be happening is a stroke, and in this case, every second counts. Stroke is one of the leading causes of death and disability worldwide. It occurs when blood flow to part of the brain is interrupted, causing brain cells to die within minutes. Average, around 2 million neurons die every minute during a stroke. That's why identifying the signs as quickly as possible is crucial and can mean the difference between recovery and permanent damage, or even life and death. In this video, you will learn the 7 early signs of a stroke. These are symptoms that can appear suddenly and are often ignored or confused with other conditions. Knowing how to recognize them can help you save a life, including your own. Before we begin, make sure you are subscribed to the channel. This simple gesture helps the content reach more people and multiplies the impact of this vital information. Now, let's move on to the first and perhaps most visible warning sign: sudden weakness on one side of the body. The first sign that deserves immediate attention is sudden weakness on one side of the body. This symptom can affect an arm, a leg, or even the entire side of the body, and it comes out of nowhere, without warning. It's as if the person suddenly loses the strength to hold an object, lift a glass, or even walk in a straight line. Often the person tries to lean on something, thinking that they are just tired or that their leg is asleep. However, unlike common numbness that improves within minutes, the weakness caused by a stroke is persistent and does not improve on its own. In some cases, it is so intense that the arm or leg literally shuts down. A classic example: ask the person to raise both arms at the same time with their eyes closed. If one of the arms drops or does not rise, it is a strong indication that the brain is suffering from a blockage in blood flow. This is a simple but extremely effective test. This type of weakness occurs because strokes usually affect areas of the brain responsible for muscle control. When these areas stop receiving oxygen, the muscles are not controlled. The side affected depends on the part of the brain that is affected. If the stroke occurs in the left hemisphere, the right side of the body may be more affected, and vice versa. It is important to remember that even if the symptom disappears after a few minutes, this does not mean that everything is fine. It could be a sign of a transient ischemic attack, TIA, a type of mini stroke that precedes a larger stroke. In any case, immediate medical attention is essential. Don't underestimate this sign. Sudden weakness, even if mild, is a clear signal that something very serious may be happening in the brain. The sooner it is recognized, the better the chances of avoiding permanent damage. And that's just the first warning sign. Next, we'll talk about one of the most notable and yet most neglected symptoms: difficulty speaking. Difficulty speaking, or slurred speech. While weakness on one side of the body may be the first visible sign, difficulty speaking is often the most noticeable symptom in conversations with someone about to have or already having a stroke. And yet, this symptom is often confused with other conditions. The person begins to speak strangely, slurring their words, mixing up syllables, or saying things that don't make sense. In some cases, they even try to communicate, but they can't form sentences, or the sentences come out completely disjointed. It's as if the brain still wants to speak, but the bridge between thought and speech is broken. A simple way to test this is to ask the person to repeat a short sentence, such as, "It's a beautiful day today." If they have difficulty repeating, or if the words come out jumbled, call emergency services immediately. This type of alteration is a direct result of the impairment of specific areas of the brain responsible for language, such as Broca's area and Wernicke's area. Depending on the region affected, the individual may present expressive aphasia, difficulty speaking, or receptive aphasia, difficulty understanding. An important point: this symptom can also be confused with the use of alcohol or other substances. Often, the person is misinterpreted as drunk, which can delay the arrival of help. Therefore, always take the context into account and observe whether other signs are present at the same time. The sooner the condition is recognized, the greater the chances of preserving speech and avoiding permanent consequences. Rehabilitating speech after a stroke can take months, and in some cases, it is not entirely possible. Speech is one of the most direct ways of expressing who we are. Losing this ability even temporarily, is deeply limiting. Therefore, if you notice any sudden difficulty in speaking, don't wait. Take action. And if this content has been useful to you so far, don't forget to like it. This helps the video reach more people and can multiply the impact of this information. Now, let's move on to the next sign, one that is noticeable at a glance: the crooked face. Asymmetry in the face, crooked face. If you've ever noticed someone smiling strangely with only one side of their mouth lifting, you may have witnessed one of the most obvious signs of a stroke: sudden facial asymmetry, and or the popular crooked face. This symptom occurs when the muscles on one side of the face suddenly lose strength or become paralyzed. This happens because the brain, affected by the stroke, stops sending the correct commands to the facial muscles. The result? One side of the face appears droopy, especially around the mouth and sometimes around the eye, which may be less open than the other. A simple test to identify this sign is to ask the person to smile. A healthy smile involves both sides of the mouth symmetrically. However, if one side does not move or is noticeably lower, the sign is clear: something is wrong. Another effective test is to ask the person to puff out their cheeks or raise their eyebrows. If there is difficulty holding the air or moving one side of the forehead, the indication of a stroke becomes even stronger. Facial asymmetry is one of the easiest symptoms to visually detect, which makes it a valuable sign for early recognition. However, it is also one of the most ignored, especially if the person is trying to hide their smile or is wearing a mask, something that is common these days. It is important to understand that this change is not painful, which may lead the victim to not realize that something is wrong. Those nearby, on the other hand, need to be alert. Active observation is essential in these moments. Facial asymmetry is not something to wait for it to go away. It is a clear sign that the brain is in danger and medical help is needed immediately. Now that we've covered what you see on your body and face, it's time to go a little deeper. The next sign is about understanding, or rather the sudden inability to understand what others are saying. Difficulty understanding other people's speech. Imagine talking to someone who seems to be listening to you but doesn't understand anything you say. You repeat yourself, speak more slowly, and yet the person still looks confused, as if they are in another world. This is another silent but extremely dangerous sign of a stroke: sudden difficulty in understanding words. Contrary to what many people think, strokes do not always only affect speech. Sometimes they compromise the ability to understand what is being said. The person hears but does not process. It is as if the spoken language had suddenly turned into an unknown language. This symptom can be confused with inattention, stress, or even momentary deafness, but it is quite different. The person's gaze reveals real confusion. They try to follow the conversation, but they can't, even if you speak slowly. This alteration is related to comprehension aphasia, linked to Wernicke's area, located in the left temporal lobe of the brain. When this region is affected, the brain loses the ability to decode language. Even if hearing is normal, the biggest risk here is wasted time. Since the person does not appear to be in pain, they may just seem disconnected or distracted. In situations like this, it is essential to observe whether this symptom is accompanied by others, such as slurred speech, a crooked face, or weakness on one side of the body. The sum of these small signs builds a clear picture. The brain is under attack, and the sooner you recognize this, the greater the chance there is of a positive outcome. While you're at it, leave a comment if you've ever seen any of these signs in someone. Your story may help other people identify similar situations. In the next chapter, we'll talk about something that can also appear suddenly and alarmingly: vision loss. Even if it's temporary, it can be a sign that something very serious is happening. Sudden loss of vision. Few things are as frightening as having your vision suddenly go black. Sudden loss of vision, whether partial or complete, is another important sign of a possible stroke, and unfortunately, it's often attributed to the wrong causes, such as low blood pressure, fatigue, or migraines. This symptom can manifest itself in different ways: blurred vision, dark spots, clouding of one eye, or even complete loss of vision on one side of the visual field. And most worryingly, this can last just a few seconds, which leads many people to ignore the episode, thinking it was an isolated incident. What's behind this symptom is the interruption of blood flow to the areas of the brain responsible for vision, usually in the occipital lobe. In some cases, the ophthalmic artery can also be affected, damaging the retina. The result, a visual blackout that, even if brief, is an urgent warning. Another important detail is that the person may not realize that they have lost part of their vision, especially if it affects the peripheral visual field. They may bump into objects or have difficulty walking in a straight line without understanding why. This sign, when isolated, can also be confused with common eye problems. However, if it is accompanied by severe headache, dizziness, difficulty speaking, or weakness, the chance of it being a stroke increases significantly. The key here is simple. Don't normalize sudden symptoms. If your vision suddenly disappears or changes, it's best to treat it as an emergency until a doctor tells you otherwise. Now that we've talked about what we see or don't see in the body, face, and speech, let's talk about a sign that affects balance and spatial perception. Next, learn about intense dizziness and loss of coordination, another warning sign that you need to know how to identify: dizziness or loss of balance. Not all dizziness is a sign of a serious problem, but when it appears suddenly, intensely, and disablingly, it deserves your full attention. Sudden loss of balance or motor coordination is another common symptom of a stroke, and unfortunately, one of the most ignored. In this condition, the person may feel that the floor is shaking, that the room is spinning, or that they are going to fall at any moment. They may have difficulty standing up, walking straight, or even sitting still. Unlike common dizziness, such as that caused by labyrinthitis or low blood pressure, dizziness that occurs during a stroke is usually accompanied by other symptoms, such as slurred speech, double vision, or nausea. In addition, this loss of balance does not improve quickly with rest or drinking water, as many believe. This symptom is linked to damage to the cerebellum or brain stem, regions responsible for coordinating movements and maintaining our sense of spatial direction. When a stroke affects these areas, the body loses its sense of stability almost instantly. The danger here is that, because it is a symptom also associated with benign causes, many people simply wait for it to pass. And in the meantime, the brain continues to suffer damage. If someone close to you feels very dizzy, fainting, or unsteady when walking, especially if it is associated with other symptoms that we have seen so far, do not hesitate. Call for help immediately. And if you find this content useful and important, leave your like right now. This helps us bring this knowledge to more people and can make a difference in someone's life. In the next chapter, we will talk about a symptom that, despite seeming common, may be the only warning before something very serious: an extremely strong and sudden headache. Very severe and sudden headache. Everyone has had a headache at some point in their life, but when this pain comes on extremely suddenly and is unusually severe, it stops being normal and becomes a red flag. This type of pain may be the only apparent symptom of a stroke, especially in the case of a hemorrhagic stroke where there is bleeding in the brain. People who have experienced this often describe the pain as the worst ever, likening it to an explosion, a sudden hammering, or unbearable pressure that comes out of nowhere. Unlike a migraine or tension headache, this pain doesn't warn you that it's coming. It just happens, intense and immediate. This symptom may occur alone or accompanied by other signs such as nausea, vomiting, loss of consciousness, mental confusion, or even seizures. In some cases, the patient is unable to even express what they are feeling and only shows extreme discomfort and changes in behavior. The most dangerous part is when the person tries to resist, believing that it will pass. Time, once again, is crucial. A headache of this intensity and sudden onset, especially in people with a history of high blood pressure, should be treated as an absolute medical emergency. Another important point: do not self-administer medications, such as painkillers or anti-inflammatories. They can mask the symptoms or even worsen the condition, depending on the type of stroke. Pain is the body's most direct warning that something is seriously wrong, and in the case of a stroke, it may be the only sign that the brain is suffering immediate and serious damage. Now that you know all 7 of the main signs, it's time to understand what to do when they appear, and how taking the right action can save a life. What to do when you recognize the signs: don't wait to see if the symptoms will go away. Don't try to give the person medication or put them to sleep. Time is the most critical factor. The sooner you get medical attention, the greater the chances of recovery and the lower the risk permanent after effects. If you are with someone who is showing any of the signs we have discussed, weakness, slurred speech, a crooked face, difficulty understanding, loss of vision, dizziness, or severe headache, call for help immediately and remain calm. Stay with the person, keep them from moving, and monitor their signs until help arrives. Remember, every second counts, and now you are in a position to make a difference. Not just for yourself, but for your family, friends, neighbors, and coworkers. Recognizing the signs saves lives, and sharing that knowledge is one of the most powerful ways you can care for those around you. If this video helped you, subscribe to the channel now. That way you can continue receiving important information about health and prevention. And of course, share this content. The more people know about this, the better protected we will all be. Thanks for following along this far, and take good care of yourself and those you love.